You might be surprised to hear this. After decades of practicing medicine, I've met countless patients who walk into my office with a tired smile and the familiar line, "Doctor, my back is probably done for. I'm getting old." But what I often tell them is, your back isn't giving up on you. If you're willing to give it a little chance, and then I share something so simple it catches many off guard walking. Sounds ordinary, doesn't it? We've been walking all our lives. Yet few of us think it could be the remedy for that dull, persistent backache every morning. I still remember one patient in her early 60s who used to rely on pain medication almost every day. After just a few months of gentle daily walks, she came back and said, "Doctor, not only is my back less painful, but I feel younger." This isn't magic, it's science. Research shows that walking for just 30 to 60 minutes a day, 3 days a week, can significantly reduce the risk of chronic back pain, especially for those over 50. Before we get into the details, I want you to picture this. Your back is like a bridge. If it's regularly maintained and supported, it will stand strong for years. But if it's left under constant strain without relief, small cracks will eventually appear. Walking is the simplest way to maintain that bridge. So why does something as familiar as walking hold such power? And how can you turn it into a habit that makes your back stronger every day? Let's begin today's conversation. Benefit number 1. Walking. A simple yet powerful remedy for back pain. There are exercise routines that sound impressive. Pilates, yoga, strength training, and yes, they can be effective for back pain. But what often surprises many of my patients is that walking, something we've been doing since we were toddlers, can be just as effective. And best of all, it's simple, accessible, requires little to no equipment, and doesn't demand complicated techniques. I still remember a patient named John, 62, who had tried every online workout he could find to ease his back pain. He did plank squats and even bought a treadmill for high-intensity training, but before long his back hurt even more from improper form and overexertion. That's when I suggested, "John, let's put those heavy workouts aside for now, just start walking." He laughed. "Walking will, that even help?" Yet 6 weeks later he returned smiling, telling me his pain had eased, his sleep had improved, and he no longer relied on painkillers every night. Science backs this up. Studies comparing walking to other exercise programs have found that improvements in pain relief, function, and quality of life are similar. In other words, walking holds its own against more complex workouts, with the added advantages of being safer, carrying a lower risk of injury, and being suitable for those unaccustomed to intense physical activity. Walking engages the muscles that support the spine, improves blood circulation, and nourishes the spinal discs, much like oiling a stiff machine, so it moves more smoothly. It also triggers the release of endorphins, the feel-good hormones that elevate mood and reduce the sensation of pain. The beauty of walking is that you can do it anywhere around your home, in the park, or even in the hallway of a shopping mall on rainy days. There's no need for expensive equipment, no waiting for a spot at the gym, and no anxiety over perfect form like in some exercise classes. Before I finish, I'll leave you with this question. If all it takes is a comfortable pair of shoes and 20-30 minutes of your time, would you give your back the chance to heal? Sometimes it's the slow, steady steps, not the flashy, high-intensity moves, that end up being your spine's best medicine. Benefit number 2, just 30 to 60 minutes of walking a day. 3 days a week can make a noticeable difference for people over 50. Many people believe that improving back health requires hours of exercise every day or signing up for expensive rehabilitation programs. But the truth is, a moderate and consistent amount of movement is often enough to create a significant change. This was confirmed by a 2019 study published in the Spine Journal, which followed over 480 participants aged 50 and older in Korea. The results showed that those who walked 30 to 60 minutes a day, at least 3 days a week, had a significantly lower risk of back pain compared to those who were less active. I remember one of my patients, Margaret, 67, who was always busy caring for her grandchildren and managing her household. She would often say, "I just don't have time to walk." When her back pain began disrupting her sleep and limiting her mobility, I suggested, "Give yourself 30 minutes. No need to walk fast, just walk steadily." At first, she reluctantly agreed, but after just 1 month, her mornings felt lighter, her back was less stiff, and most importantly, she had more energy to play with her grandkids. So why does 30 to 60 minutes, 3 days a week, have such a powerful effect? For older adults, this is enough time to boost circulation, nourish the soft tissues around the spine, and avoid overloading the joints and muscles. Our backs don't just need rest, they need the right kind of movement to keep the structures flexible. Think of it like a door hinge. If you never open it, it will rust and stiffen. Not everyone can start at 60 minutes right away. If it feels like too much, you can break it into smaller segments, 10-15 minutes in the morning and another 10-15 minutes in the afternoon. What matters most is consistency. As I often tell my patients, you don't need to walk faster than anyone else, just walk more often than you did yesterday. So ask yourself, this week, how many days will you dedicate to walking for the health of your back? The answer you give might be the start of a habit that transforms your life. Benefit number 3, short 5-minute walks. Can relieve back pain caused by prolonged sitting or standing. One thing many of my patients don't realize is that back pain isn't only triggered by big events like lifting something heavy or exercising incorrectly, but also by small everyday habits. Sitting still at a desk for hours or standing in one spot for too long can silently strain the spine. The spine is like a flowing stream. If the water stops moving, it becomes stagnant and unhealthy. An interesting study found that simply breaking up static positions with a gentle 5-minute walk every 25 minutes significantly reduced the likelihood of developing back pain. You don't need to jog or work up a sweat. Just stand up, walk around the office, down the hallway, or step outside for some fresh air. I recall a patient, David, 64, a retired carpenter who still enjoyed woodworking at home. He often spent hours in his workshop, and by the end of the day, his lower back ached. After I suggested setting a timer to walk around the yard every 25 minutes, he noticed a big difference. Within just a week, that heavy, stiff feeling in his back by evening had greatly diminished. Short walks improve blood flow, nourish the spinal discs, and relieve pressure on joints and ligaments. Just as importantly, they give your muscles a chance to relax and reset your posture. Don't underestimate the power of those few minutes. They can be nutrition for your back throughout the day. So if your job or daily habits require long hours of sitting or standing, ask yourself, have I given my back enough breaks today? A few minutes of movement may be the quick, valuable ticket your spine needs to escape the strain. And when combined with longer walking sessions during the week, you may be surprised at how much better your back feels with every step. Before we move on, I'd like to pause for a moment to hear from you. Have you ever tried adding short walking breaks into your day? Just 5 minutes, yet sometimes they can make your back feel surprisingly lighter. If you've already tried it, share your experience in the comments below. Your story might give someone else the push they need to get started. Now that we've talked about the value of those small steps throughout the day, let's explore how gentle, consistent walking can even help you cut down on daily pain medication. This is a benefit many of my patients have experienced, and I believe you can too. Benefit number 4, gentle steps. Can reduce your dependence on daily pain medication. When back pain strikes, many people instinctively reach for a bottle of painkillers. And yes, medication can offer quick relief, but the problem is it only silences the alarm bell without putting out the fire. Over time, frequent use can bring unwanted side effects, including harm to the liver, kidneys, or stomach. Something I've unfortunately seen in many of my patients. I once treated Linda, 61, who had gotten used to taking pain medication almost every night. When I suggested replacing some of those pills with walking, she laughed. "Doctor, I'm in so much pain I don't even want to get out of bed." But we started small, just 10 minutes in the morning around her yard, gradually increasing to 20-30 minutes. 3 months later, she barely needed medication at all. She told me I never thought I could go to bed without those pills, but now I can. Science explains why this happens. Walking stimulates the release of endorphins, natural chemicals in the body that reduce pain perception and create a sense of well-being. It's like having your internal pain relief system, but without the side effects. Walking also improves blood circulation, helping inflamed tissues or tight muscles receive nutrients and recover faster. Perhaps just as important, walking gives you a sense of control. You're no longer entirely dependent on a pill to have a comfortable day. Instead, you're actively making choices that strengthen your body and reduce pain at its root. So if you're holding a painkiller right now, ask yourself, what would happen if I replaced it with a gentle walk today? You might not stop taking medication overnight, but step by step, you may find you need it less and believe more in your body's power to heal. Benefit number 5, starting with just 10 minutes a day, step by step. Restoring the strength and flexibility of your back. Many people believe that to get real results, they need to start with intense long workouts, pushing themselves until they're out of breath. But when it comes to the back, especially one that's been chronically sore or weakened with age, starting slow is the key. I once met Patrick, 65, a former office worker. After retiring, he spent much of his time reading, watching TV, and barely moving. His back pain began as a mild ache, but eventually spread to his hips and disrupted his sleep. When I suggested starting with just 10 minutes of walking a day, he sighed, "Will so little really help?" "Doctor," I simply replied, "let's let your feet answer that." And they did. After only 2 weeks, he noticed it was easier to stand up. His steps felt lighter, and most importantly, he felt confident enough to increase his walking time. Science has shown that even a modest 10 minutes of consistent movement each day activates the small muscles around the spine, boosts circulation, and reduces pressure on the discs. It's like watering a plant. You don't need to flood it. Steady daily watering helps it thrive. The beauty of starting small is that it breaks through the mental barrier. You no longer feel like you don't have the strength or don't have the time. A short walk is easy to fit in, whether it's in the morning before breakfast or in the late afternoon when the air is cool. Once the habit is formed, increasing to 20 to 30 minutes happens naturally without forcing it. So if your back is calling out for help today, don't think about walking for hours right away. Just put on your shoes, step outside, and give yourself 10 minutes. You may be surprised to discover that the first steps are often the most important ones in the entire journey. Benefit number 6, walking with proper posture protects your spine, builds endurance, and prevents back pain from returning. Not all walking is automatically good for your back. I've seen many patients complain that their back felt worse after trying to walk for exercise. When I observed them, I realized the problem wasn't the walking itself, it was how they were walking. Poor posture can put extra strain on the spine, especially the sensitive lower back. Proper walking posture starts with standing tall. Imagine a soft string gently pulling you upward from the top of your head, keeping your back straight without stiffness. Then lean forward slightly from the hips, not the waist, to create natural forward momentum. Each step should land with the knee slightly bent, avoiding a locked knee that sends shock up the spine. When I teach patients to gently engage their core while walking, they're often surprised at how much more supported their back feels. This matters because your abdominal and deep back muscles act like a natural belt protecting the spine. And don't forget to swing your arms opposite to your stepping leg. Not only is this a natural walking rhythm, but it also improves balance and reduces strain on the back. I recall Eleanor, 70, telling me, "Doctor, I've walked all my life, but this is the first time my back feels light while I walk." With just a few posture adjustments, she went from 15 minutes a day to 40 minutes without the soreness she once dreaded. Research supports this proper walking posture helps distribute forces evenly across the spine, reduces disc stress, and optimizes the engagement of supporting muscles. In other words, walking the right way doesn't just ease current pain, it also keeps future pain from returning. So before your next walk, take a moment to check your posture. Sometimes a small change in how you step can make a big difference for your back health. Benefit number 7. A good pair of shoes quietly protects your back with every step. It may sound simple, but the shoes you wear can make or break your walking experience and your back health. I've met many patients who told me, "Walking made my back hurt more," and when I checked, the issue wasn't their back or posture, it was their worn-out shoes that had lost all cushioning. A good pair of walking shoes works like a car's suspension system. It absorbs the impact from each step, reducing the shock that travels up through your knees, hips, and ultimately your spine. Walking shoes should have enough cushioning to absorb impact, good arch support, and a snug but comfortable fit. They should also be free from uneven wear on the soles, which can throw off your body's alignment. For people over 50 whose soft tissues and joints may no longer be as resilient, this becomes even more important. I remember James, 68, who walked 45 minutes every morning but developed sharp lower back pain after just 2 weeks. When I asked about his shoes, he said, "I've had these for years, they're still fine." But the heel was noticeably worn and tilted. After switching to a supportive, well-fitted pair, his pain disappeared. Experts recommend replacing walking shoes every 6-12 months or sooner if you walk frequently and the soles wear down. Rotating between 2 to 3 pairs can also help distribute pressure differently on your feet, reducing strain on your back. When shopping for shoes, try them on in the afternoon when your feet are slightly swollen from daily activity. This ensures the most accurate fit. And pay attention to your body if your back or joints start aching unexpectedly. Your shoes might be the silent culprit. The right shoes won't just help you walk farther and longer, they'll quietly safeguard each vertebra, making every step lighter and safer. Your back may not say it out loud, but it will certainly thank you for the investment. Benefit number 8. Knowing when to pause your walk keeps your heart and lungs safe. Walking is safe for most people, but like any form of exercise, it isn't suitable for absolutely everyone at all times. For those with serious heart or lung conditions, or who have recently experienced chest pain, jumping straight into a walking routine can be risky. I once worked with Robert, 72, who had recently recovered from a heart attack. He was eager to get his strength back, but after consulting his cardiologist, we agreed to start extremely gently, just a few minutes of walking around his home at a time. We monitored his pulse, breathing, and fatigue levels closely. If he experienced shortness of breath, chest discomfort, or unusual tiredness, he stopped immediately. Thanks to this cautious approach, within a few months, he was walking 20 to 30 minutes per session safely. Research confirms that people at risk for arrhythmia, heart failure, or chronic lung disease should have medical clearance before walking at normal intensity. Even for healthy individuals, symptoms like severe fatigue, chest pain that worsens with exertion, or lingering dizziness are signals to stop and seek professional advice. This doesn't mean you should avoid walking altogether. Instead, think of pausing or lowering your intensity as a protective measure. Sometimes rest is the best tool to help your body recover before you push further. I often tell my patients, the goal isn't how far you walk today, it's being able to walk steadily and safely for years to come. Listening to your body and knowing when to rest is the key to making that happen. Benefit number 9. Regular walking strengthens back muscles, helping to fight chronic pain and prevent long-term damage. When we walk, it's not just our legs that are working, the entire network of muscles along the spine is engaged. The erector spinae, transverse abdominis, and hip muscles. These all work together to keep your back upright and stable. They form a natural armor that protects your spine from daily stresses and impacts. I once treated Susan, 66, who had lived with chronic back pain for nearly a decade. She had gotten used to sitting often, avoiding lifting, and cutting back on most physical activities. When I suggested walking, she was doubtful. I'm too weak for that. We started with 10-15 minutes a day, moving slowly and taking rest days in between. Within 2 months, she noticed she could stand longer without discomfort, carry light items without fear of triggering pain, and move with more confidence. Studies show that walking improves the endurance of back muscles and increases the flexibility of soft tissues, which helps reduce the frequency of pain flare-ups. This is especially important for people over 50, when muscle mass and ligament elasticity naturally decline. Stronger back muscles don't just relieve current pain, they also protect against new injuries, much like reinforcing a house's foundation before the next storm. Walking also stimulates blood circulation, delivering oxygen and nutrients to the spinal discs, keeping them elastic and resilient. When these shock absorbers stay healthy, every step feels lighter and less stressful for the spine. If you're living with chronic back pain, remember, muscles are like a security team. The more regularly they're trained, the faster they respond and the better they protect you. And there's no safer, more effective way to train them than through consistent, steady walking. Benefit number 10. Small, frequent walks throughout the day can nourish your spine better than one intense workout. Many people think that doing one big, intense workout each week can make up for sitting or standing still the rest of the time. But when it comes to your spine, consistent, regular care is what truly matters. The spine is like a finely tuned instrument. If you only tune it once a month, it will quickly fall out of harmony. I once had a patient, Harold, 70, who worked out only on Saturdays. He cycled, lifted weights, even jogged. But the rest of the week, he was mostly inactive. His back still ached and sometimes seized up without warning. I suggested changing strategies. Instead of one big burst, break it into several 5 to 10 minute walks throughout the day. He reluctantly agreed. 3 weeks later, he admitted his back felt noticeably better and his stamina had improved. Research confirms that short, repeated bouts of movement during the day help maintain steady blood flow, deliver nutrients to spinal discs and muscles, and keep tissues from stiffening. In contrast, sitting or standing for long, uninterrupted periods keeps the spine under constant pressure, like an elastic band stretched too long, eventually losing its flexibility. Frequent walking also sustains energy and boosts mood. Each time you stand, take a deep breath and walk. You're not just helping your back, you're also refreshing your mind. For people over 50, these benefits add up over time. Each small step today is an investment in a stronger, more flexible back for years to come. So don't wait for workout time to move. Treat every chance to stand and walk as a small dose of medicine for your spine. Those little steps, though, brief, are quietly maintaining the main axis of your body, so you can enjoy life with a back that stays steady and supple. You see, sometimes the simplest things hold the greatest power. We've walked together through 10 powerful benefits of walking for your back, from reducing pain and building muscle endurance to improving circulation, lifting your mood, and keeping you active for years to come. No fancy equipment, no complicated exercises, just your legs, a good pair of shoes, and a few minutes a day can begin the journey of restoring your back. I've witnessed so many patients, people who once believed I'm too old to change, now walking more lightly, moving with more confidence, and most importantly, living free from the constant fear of pain. Every step they take is a statement that the body can recover, that age is not the end of strength and flexibility. Walking is not a race. You don't need to compare yourself to anyone else. Maybe today you walk slowly, and tomorrow you go a little faster, or just a little farther. What matters is consistency. Like drops of water filling a jar, every small step you take adds up to a stronger back and a fuller life. And if you're watching this with a bit of hesitation, ask yourself, what might change if I start tomorrow? The answer could make you smile, because sometimes the biggest transformation starts with the smallest decision. Before we wrap up, remember this. No one cares about your back health more than you do. Give yourself the chance. Give your legs a chance. And you'll see each step is a valuable investment in your future. If you found today's video helpful, don't forget to like this video, subscribe to Health Hype Zone so you won't miss our upcoming tips and insights, especially designed for people over 50. And I'd love to hear from you. Share in the comments. How will you start your walking habit tomorrow? Your story might inspire someone else watching, just as you've been inspired today. Remember, health is not a gift you receive once, it's the result of what you do every day. So why not start right now with a single step?